Hello. Hi, Amelia here from Higher Standards Caregiver Training. I'm here with your 10-minute 2-tip Tuesday. Yes, I do realize that it is Wednesday. I'm not that confused. But yesterday I was at a business conference all day, and I didn't want to miss out on giving you the tips that you absolutely need in order to make sure that you as caregiving organizations are able to care for your clients and care for your businesses as best as possible. So we only have 10 minutes. I'll go ahead and get started. I am broadcasting live. This is my first time. So if it is horrible, please just let me know. I'm learning as I go here. But anyway, let's go ahead and get started. We only have 10 minutes. Before we jump into this first tip, just a reminder, as always, that this is educational content. It is for education only. It is not a substitute for getting direct medical intervention. So if this reminds you of yourself or another person that you think needs medical intervention, then please seek out advice from the correct healthcare provider. That said, let's go ahead and jump into our first tip, which is all about stroke survivors. So most caregiving organizations, if not all of them, probably work with at least one, if not many, stroke survivors. And as you know, strokes affect the brain, and the brain controls literally every area of functioning in someone's life. So, of course, there's cognitive function, sensorial function, physical function. All of these things can be affected by stroke. There's one particular function that can be frequently affected, unfortunately, particularly in strokes that affect the left side of the brain. And that is someone's ability to communicate with language. So when someone has a stroke and their ability to communicate with language is affected, we call that aphasia. It's just a fancy medical term meaning that someone's ability to communicate using language is impaired in some way, shape, or form. Now, there are different kinds of aphasia. So the first kind that we'll talk about is one where maybe someone can understand everything that is being said to them, but they are not able to form the words that they would like to form in order to communicate back. The second kind of aphasia is called receptive aphasia, and that is where someone is able to physically form words, but they're unable to understand the language that is being spoken to them. And I'm not talking like as if you're speaking a different language. They're unable to process the meaning of the language. And then there's the third kind of aphasia, which is global aphasia, which encompasses both of those. So the person is not able to understand what is being said to them, and they are unable to form words physically. And of course, aphasia falls along all kinds of gradients for all three of those things. It's not a black and white a black and white issue. You know, there can be gradients of understanding on the spectrum for all of those kinds of aphasia. But there are some really important things that caregivers need to know in order to care for someone who has aphasia more safely and effectively, and certainly in a way that's going to be less frustrating for both the caregiver and the person that they're caring for. So the first thing I'm going to tell you is actually something not to do. So if a caregiver is working with someone who has aphasia, something that they should absolutely not do to try to increase their ability to communicate is speak more loudly. Speaking more loudly is not going to help this person understand language or to be able to communicate any better, because the problem is not with their hearing function, it's about how the brain processes language. So speaking more loudly instead actually could be interpreted by the person who has aphasia as really just being yelled at for no reason. So we don't want to do that. But there are some things that caregivers can do that can make communicating a little bit easier. And the first couple I'm going to go over are really key, especially if you're talking with someone who has some of that receptive aphasia, who's not able to understand or process that language, that understanding. So one of the first things that you can do that's really important is to slow down. Just speak a little bit more slowly and make sure that you're speaking very clearly. The other thing that you can do is to shorten sentences and make them more simple. Now, this doesn't mean using baby talk or talking down to the person being cared for, but literally just, making sure that sentences are short, sweet, and to the point, making sure that there are not multiple instructions given at the same time in a sentence. Because the more words there are, the more information there is to process, the harder it is for that person to process. Now, universally, regardless of what kind of aphasia someone has, there is one thing that is absolutely helpful no matter what, and that is to give the person being spoken to, the stroke survivor who has aphasia, give them time to process what has been said to them, and then also time to respond. Never assume that because you've heard the first couple words that a stroke survivor wants to say, that you know what they're trying to tell you. In fact, often if someone is having trouble finding the right words, they may at first say words that are completely unrelated to the need or the desire that they're trying to express. So give them time to communicate as effectively as they possibly can. And that will certainly help to lessen their frustration. Another thing that is a great thing to know is sometimes, of course, folks have this global aphasia and they're truly unable to communicate very effectively at all. There are communication devices, communication strategies that can be used for folks in this situation. Things as simple as picture boards, where the person might be able to simply point to a common need or item in a list of pictures so that they can make their needs known in that way. Of course, communication devices can also be extremely complicated and be very sophisticated. The best person to appropriately assess and determine what the right communication device is for someone with aphasia is absolutely a licensed speech language pathologist. So if you're thinking of someone right now who you think would benefit from a communication device, definitely advocating for that person to be assessed by a licensed speech language pathologist is the way to go. Okay, so that's it for the first tip for 10-Minute 2-Tip Tuesday on Wednesday. The second thing we're going to be talking about today, as always, is a business tip, something to help caregiving organizations grow stronger, be more effective, just be better overall. And so this one it's not a particularly fun tip. It's not something that many folks like to do. However, it is really, really necessary, and that is to track your numbers. It's so important in any organization, but certainly in a caregiving organization, to make sure that you are tracking your numbers so that you can have objective evidence of what is going on in your organization, what's going well, what's not going so well. And then that allows you to ask the right questions to get down into the root causes of problems so that you can actually solve them. It's absolutely important. As I said, sometimes it's not something that we like to do, but it's essential in order to be able to make objective decisions based on data as an actual leader or a business owner of a caregiving organization. I'll give you an example of a number that's really important to track, and that is the average length of service. So the average amount of time that you are serving your clients for. This can have a huge impact on the financial wellness of a caregiving organization, the average length of service. And it also can be used as an indicator to tell you if maybe you're having an issue with training, an issue with quality, or any other issues that might need to be addressed to help increase that average length of service, keep your clients healthy and happy and with your organization. So that's it for me for today's 10-Minute 2-Tip Tuesday on Wednesday. Next week, I actually will be back on Tuesday at 3 p.m. Central Time to share another 2 tips with you. If you are interested in metrics, in understanding education and metrics, how they relate and what you need to be tracking in your organization, I'm going to be dropping a link into my feed right after I wrap up here. And that's going to have a link to an educational webinar that I'm going to be putting on September 1st at 10:30 a.m. So I'm going to drop that link in my feed. Click on it, register. If you are interested in education, how to use metrics in your organization, then absolutely join me for that educational webinar on September 1st at 10:30 a.m. Central Time. So I'll drop that in as soon as I wrap up here, and I'm about to. For anyone who watched, thank you so much for watching, and I will see you next Tuesday. Until then, take care.